back in studio with us. The owner of Columbia Dental, Dr. Mohammadi, is here in studio. And Dr. Mohammadi, great time to have you here to talk about dental care. Well, it's always a good time to talk about dental care. How are you?
Very good. Thank you.
I'm glad to have you here. First of all, holistic approaches in dentistry. What does that mean?
What that means that we just not giving the treatment to the patient. Oh, okay, you need to come every 6 months, floss your teeth, brushing, fluoride. Yes, we do that, but holistic it is we looking more comprehensively on the underlying condition.
Like, what would be an underlying condition, to give an example?
For example, we have a child 14, 15 years with 6, 7 decay. So there should be another reason. It might be the food, it might be the diet, it might be certain habit. Is not always, oh, brush, floss your teeth. It is, of course, if you brush and floss your teeth, is prevent causing decay, but still the underlying condition exists. So,
and I know we're going to talk about foods with cavities, which I think is really important, but I have to imagine that, when we talk about brushing and flossing, have you seen better, I'd say, teeth health since having like the water pick, for example? So I look at our household, and I have boys in my house who will not floss their teeth. It doesn't matter how much you can look them in the eye until you're blue in the face, they won't do it. But once the water pick became a thing, I mean, talk about night and day. My son, who I've talked about before with the cavities, he does really well with it. My husband, who just hates to floss, he loves like the water pick, for example. Do you find like that, to me, is almost a holistic approach? I know we'll talk about other things, but to me, that's something where instead of having another crown, another something done, hey, how do we address something that you could be incorporating and making your teeth healthier?
Sure. Again, you're absolutely right. Like a water pick, we recommend in certain, not everybody, but in certain cases, especially, when they have diet, like they eat a lot of potato chips, Cheetos, stuff like that.
That's my son.
Those,
there he is.
those particulate that adhere strongly to the tooth structure than natural food. Mm-hmm. And this is one of the issue with the high processed food. So if we see that the teenager or even the adult has that habit of consuming high processed food, we always recommend is like those high power water pick to remove it, because these particular are sticking stronger, and even with the flossing sometimes you cannot remove it.
Get them.
Yes.
Well, and actually, Dr. Mohammadi, let's talk about that, if there are certain foods we should avoid, because it was when you and I first got connected a couple of years ago, I had talked about my son who's barely the age of 7 and yet has already had at least 6 cavities that he's had removed since. But one of the things you had said was, look, Melissa, you could brush his teeth till you're blue in the face. Unfortunately, this comes down to diet a lot of the times, and you were right. So what are some foods that we should maybe be avoiding or just be aware of that could be a holistic approach in cleaning up your teeth and having a better health?
I would say the high processed food, like food again, like those potato chips, Cheetos, are the worst that you can imagine. I know chocolate has a bad reputation and sugar has a bad reputation. Yes, sugar is not good if it stay in the mouth.
Well, that's what you're saying. So we're not talking like the calories or the trans fat. You're saying what sticks to the teeth.
Teeth is the worst thing to do. Believe or not, even chocolate has some antioxidant that is actually good for periodontal disease. So dark chocolate, consuming chocolate is not that bad, especially if you brush and floss your teeth. But these high processed food, because they trigger the inflammatory disease, and periodontal disease is an inflammatory disease. So a study shows people that they consume a lot of those high processed food are more prone to having periodontitis and periodontal disease as well as cavity.
Wow. So even if you may think you're, because of course, I think the average person would say, yeah, of course, potato chips, Cheetos, what have you. But you're saying high processed foods. I mean, that's something to look at across the board, not just the junk food. I mean, there are a lot of high processed foods that could
Correct,
be considered
yes.
healthy, but that doesn't mean it's not sticking to your teeth.
Correct.
Yeah.
And it's not just a steak in the teeth. The product that they are, or the dyes and chemical that they use in those high processed food or preservative, they are a trigger the inflammatory process, and that is a periodontal disease. Is they trigger that disease.
What about, we're talking to Dr. Mohammadi again with Columbia Dental and in preventing, cavities and, as you mentioned, periodontal gum disease. What about drinks? We talk about food a lot, but what about drinks? Because sometimes there are ones that we say like, oh, this will stain your teeth. But is that sort of connected? And if so, which drinks should we be sort of aware of?
Okay. Let's say what we should drink first before we
Let's start
can.
with optimism.
Let's go with optimism. My favorite one is green tea, and green tea for many reasons. They have chemical called paraphenols. Those paraphenols are antibacterial. There is certain bacteria that cause gum disease. It's called Porphyromonas gingivalis. And a study shows that a specific chemical in green tea can kill those bacteria. So if you have periodontal disease, is a green tea.
It's a crime fighter.
Exactly.
Wow,
And besides that, other foods that they contain the same chemical are strawberry, blueberry. All the berries are very good also to.
Yeah, they're warriors.
Yes,
like those
they are fighting the periodontal disease. In terms of the cavity, my favorite one is cheese. Yes, cheese. Cheese is.
You can't tell an Italian about cheese. Are you kidding me?
Yes. And this is the approach that we take at Columbia Dental. If we see a patient with a high caries rate or whatever, it's not like we give them all the preventive, they use the water, big flossing, brush. We give them some nutritional advice, okay? If not, they are hypertensive, because I am, and my wife doesn't let me to have too much cheese. But besides that, is if you're not hypertensive, you're not worried about too much cholesterol or whatever, cheese is a perfect food for fighting cavity.
Wow.
So, and if you're a fan of Italian food, why not?
Yeah.
Okay. The reason and the cheese is so good is that because they have mineral, they have calcium, phosphorus, which they help for remineralization of the enamel of the tooth. They make the tooth stronger. But on the top of it, cheese has a protein called casein, and that protein, it bonds to enamel of the teeth and doesn't let the bacteria. It's called Streptococcus mutanis, which cause the decay to adhere to the tooth structure.
Wow.
So, people, they talk too much about fluoride, but hey, we got here cheese, eat cheese and, to fight cavity. So,
that's pretty cool.
Yeah.
That's pretty cool. Dr. Mohammadi, if people want to call your office, make an appointment, learn more, what is the best way to reach you? Would it be your website?
Yeah, website columbiadental.com, or they can call us 860-645-0111, 7 days a week, open 7 a.m. to 9 p.m.
Well, Dr. Mohammadi, it's always a pleasure to have you in studio. Thank you so much, and I'm sure we'll talk again soon.
Thank you so much, Melissa.
You're very welcome. We're going to be right back. You're listening to Melissa